problem. Everyone still wants to learn more. Okay. I think you're all the same folks who were here before. I'm Erica. And just like the last one, an hour is not long enough to talk about all the ringworm things, so we're going to do this as a choose your own adventure. Those were my favorite books as a child, and now my kids are old enough to do this and they think it's really fun. So I just want to get a sense of what you all need to hear. I've got it all here in the PowerPoint, but I'll just either skim over some slides or dive deeper depending on what you need. So raise of hands, how many of you would like to hear more about how to identify and diagnose ringworm? Okay, how about learning how to do fungal cultures in-house? Okay. Ringworm treatment. Okay. When do we release ringworm cats? How? And then what about ringworm in dogs? Okay. Anything else that I didn't mention that you're really hoping to learn from today? Okay. So just a reminder, ringworm, not a worm, right? It's a fungus. It's spread by microscopic spores. And I think about spores like they think about dust. And when you think about cat hair, the cat hair infected with ringworm is covered with thousands, if not millions, of little spores. And so that is how ringworm can be spread about the environment. There are over 30 species of ringworm, but only 3 that we really care about in veterinary medicine. And there's only one that we really care about at all. So we've got Microsporum canis, Microsporum gypsum, and Trichophyton species. And so this little chart will tell you if wood's positive, meaning they're going to fluoresce or glow under a woods lamp. And we'll talk about what exactly a woods lamp is later, whether it's contagious to other people or animals, and whether or not we really see outbreaks with them. And so you'll notice that M. canis is really the only type of ringworm that we need to worry about. Ringworm in dogs, typically Microsporum gypsum. It's geophilic, meaning it's found in the soil. And so usually our ringworm in dogs is often puppies, sometimes our transport, if you've got dogs that are being transported from warmer, more humid areas, where you'll see lesions on the paws or in the face from digging in the dirt. They're typically just localized and not like a full body ringworm situation. And it's easy to treat. Microsporum gypsum and Trichophyton, I am like, we do not need to worry about that. So we are going to spend some time today learning how to differentiate that, and I will say over and over, you really need to know which species of ringworm you're dealing with. And it's because we don't need to spend a whole lot of time, resources, effort on treating Microsporum gypsum and Trichophyton. Microsporum canis can happen in dogs, but it's pretty uncommon, which is funny given the name canis. Throughout this presentation now, everything I talk about, unless I say otherwise, when I say ringworm, I'm referring to Microsporum canis. I'm talking about cats, okay? So unless I say differently, Microsporum canis and cats today. Who's most at risk for ringworm? Cats, super young or super old, so compromised immune system. Like we talked about earlier, exposure doesn't mean infection. So what you need to get ringworm is a compromise of the skin barrier. So we can see that with flea bites, scratches, so you get ear mites and they're scratching, and that's any opportunity for ringworm to invade the skin and get into the hair follicle. Clipper burn, so that's another thing to think about, or using clippers. So you need a compromise of the skin barrier. It can be spread from direct contact with a ringworm-infected animal, or fomites, meaning inanimate objects like brush, or food bowl, or something like that. Cat sweater. And from a contaminated environment. But just because you put a cat in a ringworm-contaminated environment doesn't mean they're going to get ringworm, right? The host has all of these other things, like grooming, right? Cats are great groomers, so they've got sebum or wax on the skin that is a natural host defense. But if you get kind of the perfect storm of maybe they've got flea bites, maybe they're really stressed, and then so they're not grooming as well, and they're in a contaminated area or have contact with a ringworm-infected cat, that's how then you can get infection. So we find it by looking for it. We want to screen everybody on intake. How many of you do some sort of exam, look over on every animal when they come in the shelter? Awesome. And how many of you, does that include a woods lamp exam for every cat? How many of you do it for every kitten? Okay, so a few more are doing it for kittens. And then how many of you do a woods lamp exam on any cat that looks suspicious, has some hair loss, something like that? Okay. And how many of you need a woods lamp? Okay, come talk to me later. Okay. We have some funding to help with things like that for some of our northern tier shelters, so we want to make sure everyone's got a woods lamp if you need one. So by screening on intake, we can identify infected animals, but then we also need to continue doing daily monitoring and making sure your staff are empowered and aware what to look for when they're going and cleaning kennels, that if they notice some hair loss, they know who to talk to, who to talk to find out if it's been reported before. And when you have a great ringworm management program, suddenly people notice ringworm lesions a lot more readily than they did when ringworm meant euthanasia, right? Suddenly, I didn't see that. If you know that identifying ringworm means euthanasia for an animal, you're not gonna report it, right? It's gonna be a cute little kitten. And so if they know, well, actually, ringworm means they get to go into this amazing large cage space where they are going to be treated, and they get a lot of volunteer cuddles and love. Granted, the volunteers are wearing gowns and gloves, but they're getting all of that attention. They're not put in a closet and dipped with some stinky stuff twice a week, you know. So making sure you've got a great ringworm protocol can make people notice it a lot more readily. We've got a lot of screening and diagnostic tests. We've got our eyeballs to look and see, are we noticing any lesions? Our woods lamp, a trichogram, which is also known as a direct examination of the hair. We do that under a microscope. Fungal culture and PCR. These are all tools in our toolbox. Not any one of these is a perfect test. So fungal culture is I'd say woods lamp and a fungal culture are my favorites. But none of them are perfect. Okay, we're going to go through a little screening protocol here. For animal comes in, what do we do? So your screening exam at admission. Let me just see if I can get a laser. I don't. Okay. Fluorescing lesion. Okay, I'm going to see how to read. Okay, we're going to start with the easy one. No lesions. So no lesions, meaning you don't see anything visually and your Woods lamp exam is negative. They just get to go home, right? That's easy. No need to do anything fancy with them. If you've got lesions, like maybe they have a little bit of hair loss, but their Woods lamp exam is negative, then you have a few choices. And it really depends on your clinical suspicion. Does your vet, or do you feel like, oh, it really looks like ringworm? And as you get really good with using your Woods lamp, that is going to be a very, very helpful tool. Like, I feel so good about a Woods lamp exam that if it did not fluoresce, I would not be worrying about M. canis. They might still have ringworm, but they don't have M. canis, which means I don't have to freak out. But you can take a culture or a sample for PCR. You can either wait for results, or you can say, well, it was Woods negative, so I feel pretty darn good. It's not M. canis, meaning I'm not going to spread this around the adopter's home. It's not going to spread to the adopter's animals, so I'm going to let them go and tell them I'll call them with results. That's an option. Or let's say your lesions do fluoresce, then you can do a direct exam or a trichogram right in the moment. And if that's positive, you want to say that we're going to treat that as a true infection. It's ringworm. We're going to start right away. That direct exam is kind of the closest thing we have to a snap test for ringworm. So everything else takes time. Your PCR and your fungal culture take time, but you can do a Woods lamp exam and a trichogram at that same time and say, yep, we've got it. As you get really good with your Woods lamp and just seeing a lot of ringworm, you very well could start your treatment just based on your Woods lamp exam without the trichogram. I have done that. If the direct exam is negative, you might want to take, then what I would do is question your Woods lamp exam. So if you weren't the one to do it, or if you are not super confident in your Woods lamp exam skills yet, I would ask for a second opinion. And we're going to go over some pictures of what the true Woods positive hairs look like and what some false positives look like. So your visual exam, ringworm, so yes, hair loss is a thing, but the key word with this is inflammation, and inflammation of the skin and the hair follicles. And I put this picture of the cat on the bottom right. Like, how often do we see what we think of as chin acne, right, or miliary dermatitis? That can often be ringworm as well. So that's all inflammation. Doesn't always, it can be circular, but it very often isn't in animals. In people it tends to be, but in animals it's not usually a ring. Okay, your Woods lamp exam, this is not your black light that you get at Spencer's Gifts in the mall. It is, you need to have a cord. It needs to have a wavelength of 365 nanometers. You can get them with magnification, so the white one has like a little magnifying window that you can look through. If you're doing it by yourself all the time, that's great. I am often training, or if you have a lot of turnover at the shelter and you're trying to teach other people, I prefer the other one where you can, two people can look more easily. It's a lot harder when you're two people trying to stare through the magnifying glass, but it's personal choice. There's an example of a website where you can get one of these, but also feel free to reach out if you need a good corded Woods lamp. The only strings attached will be that I want you to use it if we buy one for you. Okay, this is important. I'm going to share something that I learned not that long ago, actually. It was maybe 5 years ago when I was talking to Dr. Karen Moriello, who's the ringworm queen guru, dermatologist at UW, now retired. So we've known that cats fluoresce because cats with ringworm, with M. canis, the hairs will fluoresce. because M. canis produces a metabolite. The thing that I learned was that the fluorescence is inherent to M. canis, meaning if M. canis is there, it will fluoresce. So it is not we hear about like, oh, only 50% of ringworm will glow, and I could go on a soapbox about how that stat came to be and why that's not, it's misleading, but really 100% of experimentally infected cats will fluoresce. So the only reason your cat is not going to fluoresce is if it's in like incubation phase, or it's just barely growing out of the follicle and your eyes can't see it because it's so small. So M. canis lives in the follicle, and as your hair grows out of that follicle, it is being coated with this metabolite that M. canis produces, this metabolite called pteridine, and that fluoresces under the wood lamp. Going back to the Spencer's Gift black light, it will work. Like you will often, I'm sure if any of you have those, you've found ringworm fluorescing like that. But I've also seen a lot of people miss ringworm because the corded lamp and that wavelength is just, it'll make your fluorescing hair stand out that much more. Because we had some culture results and they were definitely M. canis and they were saying they weren't fluorescing. I'm like, this makes 0 sense to me. Somebody from our program went to the shelter with a corded wood lamp, and they were glowing. They just could not see it with that battery-powered wood lamp. Any questions on the fluorescence or wood lamp? All right, so true positive